Hi, this is Lydia, and I'm going to try and demonstrate how I would try and do an IVC placement on our little friend here. So you're going to want to first gather your supplies. For any procedure or treatment that you're about to do, you always want to gather your supplies and set up an area for you to work in, potentially even before your patient even arrives. If you are already anticipating having to do something, I would just suggest to get everything ready so you're not scrambling at the last minute. For this, you're going to need a restrainer. You're going to need someone to hold off the vein for you and to hold your pet still. This isn't something that a lot of animals like to sit still for, but it is something that you're going to need to have a restrainer for to keep them still, because you don't want them, jerking when you're trying to place an IVC catheter or an IV catheter. So we have our restrainer. We're going to need clippers with a number 40 blade to shave and clip the area to prep it before we do the placement of the IV catheter. You're also going to want gloves along with chlorhexidine solution for scrubbing the IV site, and that also goes with alcohol for scrubbing the IV site, and then next to your supplies that you're going to need to do the aseptic technique, you're going to want your catheter. And I would suggest, probably a 20 gauge for this. A lot of the times you're going to be using a 22 gauge needle to give injections via the IV, so you always want your catheter to be larger than your needle size. Then you're going to want your catheter plug and some medical tape that you have already pre-torn, and that's going to be a piece that is torn right down the middle into two skinnier pieces that are still pretty long. I'd say probably about 5 to 6 inches long, maybe even a little longer for your pieces of tape, and you can always, trim them at the end if they're too long. And then you are also going to need rinse to flush the catheter once it is placed. And that just helps you know if you're in the vein, and to flush out the catheter and get the vein ready for, fluids or any sort of injection or anything that you're going to be giving them via that IV. Okay, so first thing that you're going to want to do is have your patient in lateral recumbency, which our patient is kind of in right now, and you want to be talking with your restrainer who's somewhere up there, and you're going to want to shave the area first. So take your clippers, and we're going to be gaining access to the cephalic vein on one of the front limbs. So that is going to be here. The cephalic vein is located under the skin between the carpus and the elbow, kind of really right on the cranial surface here. So that's going to be our area, so I would probably suggest to shave a window there. And you're using a number 40 blade, so that's going to be shaving right down to the skin, and that's going to promote asepsis and having you be able to visualize where the vein is a little bit better once that area is clipped. So you're going to be clipping, you're going to want to clip that whole window, and with this dog, you're probably going to want to clip completely around the leg, even on the underside. There's probably going to be some feathers there that's going to get stuck up in your tape, so it's just easier just to trim those, and that will grow back, not to worry. So sometimes when you're shaving, you even want to have your restrainer holding off so you can visualize the vein better. Some dogs you're going to be able to see the vein right away, other dogs not so much. So if you want your restrainer to hold off while you're shaving to help you visualize, you can ask them to do so. So once you have adequately shaved your area, try and visualize your vein, try and visualize where the bifurcation is. You always want to place your catheter proximal to that bifurcation, and not that you're going to be anticipating having to do multiple attempts, but you always want to start distal to proximal. So I know I'm saying go proximal to the bifurcation. If the bifurcation's here, go up here, but you don't want to start puncturing at the highest point, because if you do need to repuncture, there's nowhere left for you to go. All right, so once you're able to visualize your vein and you're able to, to really know where you're gonna place that IVC, you can start scrubbing your area and prepping it. So you're gonna do 3 rotations, alternating chlorhexidine and isopropyl alcohol. So what that does is clean the area of all debris and contaminants. So you want to start in the middle where you anticipate placing that IV catheter, and do concentric circles, working your way out slowly, making sure you're not bringing any debris from the outside back into the middle. So you're going to do chlorhexidine, alcohol, chlorhexidine, alcohol, chlorhexidine, alcohol, and then you're going to let that sit for 3 to 5 minutes to ensure that it has as much contact time as possible to really disinfect that area. Okay, so your area has now been prepped properly. It's shaved. You're ready to go. You have your gloves on when you're doing that aseptic technique. I don't think I mentioned that, but you always want to have your gloves on when you're shaving the patient. I don't think having the gloves on is that important, but once you start really prepping your area with the chlorhexidine and alcohol, have your gloves on just to again maintain aseptic technique. So you're now ready to start to place your catheter. I like to kind of open my supplies even before I do that, so you can maybe loosen your catheter cap, but just don't take it out of the packaging yet, just again to maintain asepsis. You might even want to loosen that little plug at the end because that will help you get a flash when you are administering that intravenous catheter. You want to have your tape ready to go on your table, and also a biggie is the catheter cap. Depending on the packaging, you kind of want to have it at the go and ready, because once you remove the stylet, a lot of the time the blood is really flowing. You don't have a lot of time to fuss around with packaging to try and get that catheter cap open. So just a little tidbit on opening your supplies before using them. So now you're ready to place the IV catheter. So you are going to want to have your catheter and stylet ready, bevel up, and you're going to want to really go at a little bit of a 45-degree angle just to make sure that you don't puncture superficially. Again, you're going proximal to that bifurcation, but not too proximal up the leg, because you want to be able to give yourself room in case you do have to poke again. And you're at that 45-degree angle to make sure you're not going superficial, but you do not want to puncture too deep, because you don't want to puncture completely through the vein and have your catheter kind of skewering that vein. So go deep enough to puncture the vein, but not to go completely through it. And so you're going to see a little flash of blood in your catheter, and that's an indication that you're in. So once you do that, you can start pushing your catheter in all the way until you can't push it in anymore. You're going to want to carefully remove your stylet. I'm sorry, I'm going to start over because I think I forgot to let you know to communicate with your restrainer about holding off. I know I said that for shaving. So before even placing your catheter, you want to tell your restrainer to hold off. And so then when you do all of those steps to place the catheter and you see that flash, you're able to tell your restrainer to unocclude where they're holding off up here and bring their thumb down to where you just placed that catheter in the vein, and they can hold on to it for you. And then you're able to take that stylet out, put the cap on, try and not get as much blood as you can anywhere, and then that would indicate good communication with your restrainer. Sorry that I left that part out. So you have your cap on. You want to always keep your hand on, or your fingers on that catheter to make sure it doesn't come out. So you can kind of hold the sides of it until you get that catheter cap on, and then once the cap is on, you can hold your thumb there, to help you manipulate it. And so once that cap is on, you're definitely going to want to get that first piece of tape on to secure that onto your patient. And you're going to take one of these split pieces of tape that is going to go sticky side up. So if my catheter was just placed here, my tape, and here's my little catheter cap, my tape is going to go right under that catheter cap. I'm going to do sticky side up right under. It's going into the skin there, and so I'm then going to take my piece and fold it over where I just was to kind of help secure it and wrap it around the leg. And then that will allow me to then let go and pinch my catheter very gently, making sure I'm not touching that place where it is going into the skin with my fingers, but to make sure that that tape is holding on to it very well. Now that your catheter is secured onto your patient, this is when you want to flush your catheter. So you'll place the needle into the catheter cap. It'll have a little spot for a needle to go. You're going to draw back on the syringe that your rinse or your flush is in, and you want to look for a flash of blood that will indicate that you are in the vein. And then you want to push on your plunger of the syringe with your ring or middle finger, and you want to flush maybe a cc or a cc and a half in there, and you want to look for any bulging or any leaking that could happen, and that would indicate that you're through the vein or something's wrong with your catheter. So you just flushed your catheter, you got that nice flash of blood when you aspirated. When you flushed, everything went through just fine. Now you're ready to start taping more. So you have that first piece of tape on. You're going to take another piece of tape that you had pre-cut or pre-torn, and that is a piece that is notched. So here's your tape, and you rip it right here, not all the way down to the end, but just far enough. And what you're going to do is you're going to take where you just ripped that piece, and you're going to put it sticky side down, and you're going to secure this piece of tape with that. So that's going to go sticky side up on your patient, or sticky side down, I'm sorry, on your patient, and that will lock in the catheter and the piece of tape you had stuck on before, and you can do a little pinching as well, but again, be very gentle and make sure you're not touching or putting too much pressure on that one spot. And then you're going to take that piece of tape and you're going to wrap it around the whole leg, really helping secure that catheter. And then finally you have one last piece of tape that you're going to put on, and that is the other piece of the torn tape from down the middle. And you can do that to help kind of have your catheter in a little bit of a better position. It'll kind of help keep it down instead of flexing up. And so what you're going to do is you can put that one piece, you can even maybe twist it in the middle, kind of right under where your catheter cap is, sticky side up. You want to crisscross over your catheter, but you always want to make sure you're leaving a window in that catheter cap where it's clear for you to be able to see. That little window will help you troubleshoot if anything goes wrong. But other than that, you have just successfully placed an IV catheter and you're good to go.